All right, another big story coming in from United States. The Inspector General of the U.S. Federal Health and Human Services Department released a report on Thursday. It said that the department often failed to perform required background checks on workers at the emergency holding centers for migrant children who crossed the U.S.-Mexico border in 2021.
Right, absolutely. I think this issue has really plagued Joe Biden's tenure so far.
Yes.
Now, the IG's report also says that 200 workers did not have background checks for child abuse or neglect. Officials also found that 174 workers did not have FBI background checks here. Further checks, that was against the Justice Department's sex offender registry, were not performed on 42 workers. The reports come ahead of the expiration of the Article 42 on the 11th of May, Rohit.
Yes, the Article 42 suspends migrants' rights to asylum to prevent the spread of COVID, with it expiring on the 11th of May, in just a few days from now. An influx of migrants is expected. The Department of Homeland Security also released some data on Thursday. It said controlling border flows were unsustainable without more staffing.
Right, absolutely. And in the report, the Homeland Security Inspector General wrote the workload has negatively impacted the health and morale of law enforcement personnel. It added that they feel overworked and were unable to perform their primary law enforcement duties here.
And Susan Tehrani from New York has been reporting relentlessly on this migrant issue that has dogged Joe Biden's presidency. We were earlier joined by Susan Tehrani. Susan explained why did the Inspector General's office decide to conduct this audit.
During federal fiscal year 2021, an unprecedented number of unaccompanied minors arrived at the U.S. southern border, and as a result, the Office of Refugee and Resettlement, known as ORR, had to act very quickly. And what they did, they increased the number of shelter beds, but also workers as well. According to the Inspector General's report, one existing influx care facility was added, but also 14 other emergency intake centers were also opened. As a result, this audit took place to see whether or not the workers who are dealing with minors were sufficiently background checked in a timely manner, for example, for things like child abuse or neglect, among other things, and ultimately found that the Federal Health and Human Services Department failed in this regard.
Also, Rohit, another important question here is how has the Health and Human Services Department responded, and will they be taking background checks more seriously, especially now with the upcoming expiration of Title 42? Susan explains.
So the HSS agreed with the watchdog's recommendation, and January Contreras, who is the Assistant Secretary for Children and Families, wrote in a letter that that period was one of the most challenging periods for unaccompanied minors crossing into the southern border and caring for those migrant children amid the coronavirus pandemic. The letter also notes, quote, that the HSS continues to search for more efficient ways to reduce barriers to the timeless of background checks and is working in real time to improve the processes. Now, U.S. authorities say that the U.S. witnessed the highest number of unaccompanied minor crossings back in March of 2021, which was around 19,000. This past March, a few months ago, that number was 12,500.